Have you ever heard of the idea of taking a sugar pill, thinking that it was actually a pain relieving tablet, and feeling a real reduction in your pain symptoms, and then only to be told that you never took any medicine at all? You'd feel kind of foolish, don't you think? Well, if you want to hear more about the amazing power of the expectation effect and how this can boost your stroke survivors' chances of receiving a better physical recovery in their own homes, then this video is definitely for you. Hi there, I'm Dr. Kenneth Monaghan. I'm a neuroplasticity expert and a rehabilitation specialist, and I have an absolute passion for trying to develop your home and your stroke survivor's home as the best place for their physical rehabilitation. So let's get things straight here from the start. From all my years of experience, working as an allied health professional, working as a physical therapist, working as a researcher, working as an academic, I absolutely believe that 80% of the benefit of any of my treatments over the years is due to what people call the placebo or the self-belief effect. And because the placebo or the self-belief effect exists, a successful recovery will not be possible for your stroke survivor unless they understand certain psychological principles that we're going to discuss now. And the start of these psychological principles is this fundamental fact that our brains acts like a pharmacy, and it can instruct our bodies to create important chemicals which are based purely on what we believe and what we expect to happen. And this determines the success and failure of our recovery after stroke. So that big message is that our brains act like a pharmacy, and what we believe, what we actually expect will happen, will determine what our brains create, the chemicals and the hormones that we create in our bodies. A second thing is that from all the years that I've worked as a physical therapist, it's also my experience that the perceived value of any therapy that's been carried out by a stroke survivor or by stroke survivors that I've worked with depends on the interaction between the therapist, between myself and my patients, the therapist and the stroke survivor during treatments. And what the stroke survivor thinks of the therapist has more effect on the outcomes than the actual physical treatments themselves. And this is an absolutely amazing fact, but it's true. So the main benefit of a treatment is a product of the stroke survivor's belief in the treatment, and then the number of repetitions that are done with that safe treatment for the arms, for movements, for strength, for balance, and for walking. It's absolutely essential that your stroke survivor must genuinely believe and accept that this is true. Because if they do, their bodies will react and behave. And the number of repetitions that are completed will not release the same hormones in response to treatments if you do not believe this is true. And now it's time to explain a very, very interesting study that was carried out in Stanford University a number of years by Professor Ali Akram. It's called the milkshake experiment. And the milkshake experiment essentially goes along this line. 46 students were randomly divided into two halves, and one group of them were told and given a specially formulated milkshake, and they were told that it was very high in calories. It was so high, in fact, that they were unlikely to need any food for that day. The other group of students were given a specially developed milkshake, and they were told that it was very low in calories. It was so low, in fact, that they probably would need more meals for the rest of the day. And of course, the question they were asking was, which group produced the most hunger hormone, ghrelin, after they had taken their smoothie or they had taken their milkshake? And of course, as you would expect, the group with the low-calorie milkshake, of course, produced much more hunger hormone in the bodies. And this is what we would have expected to happen, except for the fact that both groups were given the same milkshake. In fact, Professor Crum, who did the experiment, said the ghrelin levels dropped about 3 times more when people were consuming, the what she called the indulgent shake, or thought that they were consuming that indulgent shake. So this is an absolutely amazing message that it delivers, because it says that our bodies respond physiologically to what we believe. When the students in this experiment, when they believed that they were drinking a low-calorie milkshake, then their bodies responded by producing more of the hunger hormone than the students who believed that they were taking a high-calorie milkshake. And nothing other than belief can be responsible for this result. And this has an absolutely extraordinary implication for rehabilitation, because and also after stroke, because likewise, if your stroke survivor can truly believe that they will receive a recovery with their home program, then their brains should release the necessary chemicals and hormones to enhance this recovery and allow progress, allow recovery, allow neuroplasticity take place. There's a fascinating book by a brilliant author called David Robson, and his book is called The Expectation Effect. And David tells us that our expectations are everywhere. They're just like the air we breathe. However, we're rarely aware of their presence, these beliefs. And David's important message in this book is that the outcomes of what you as a caregiver or your stroke survivor believe is influenced by what our beliefs are to start with. So if you believe that you're capable of supervising a successful physical rehabilitation program in your own home, or your stroke survivor believes that they're capable of recovering in their own home and neuroplasticity is possible, and they can get more movement in their arms and they can get more strength, they can take better steps, they can balance better, then because of these absolute beliefs, changes will occur in their bodies, in your body, physiologically, to increase the chance that these beliefs can come true. And this is my belief. And this is what I've seen possible over all of my years of working in rehabilitation. It's an extraordinary piece of information, but it's absolutely so important that as a caregiver, you explain this to your stroke survivor before they start their physical rehabilitation program at home. Thank you very much for listening. And if you enjoyed some of the ideas in this video, then please don't be afraid to send me some comments and let me know what you think. I'll be producing more videos like these. And if you're interested in finding more resources that can be used alongside of my book, Lights, Mirrors, Action, then go to my website, which is www.lightsmirrorsaction.com, and you'll find lots more resources and lots more videos like these. Thank you very, very much for listening.